Hey guys, how are you? This is Dr. Kim. So for today's video, I want to talk about why it's near impossible to position the patient such that you have a perfect alignment of the right and left structures. If you're orthodontic residents or orthodontists or a technician that takes lateral ceph on a regular basis, you would have noticed that there's always a little bit of discrepancy in the border of the anatomic structure. And this patient, in this case, it's very, I would say, relatively well positioned. But if you look at the inferior border of the mandible, you can see two outlines, right? One here and one there. And also, obviously, the teeth do not overlap to the right and left side very well because the eruption status from the right and left is always slightly off. So let me pose this question. What if, one thing before I say that is, first of all, it could be due to patient anatomy. We all have a slight degree of probably some discrepancy from the right to left side structure, meaning the location of the porion or the external auditory meatus could be different from the right and left side. And the patients, we don't have a perfectly symmetric face. Let's start with that. So almost all of us will have some degree of asymmetry. So that's one of the first reasons. But what if you can have a perfectly symmetric face, near perfect? Even then, you would still not be able to have a perfect alignment of the right and left side. So why is that the case? And in order to answer that question, you have to understand the geometry a little bit. You have to know where the source of the radiation is and where the patient is located, and location of the radiographic, the imaging medium, whether it's a sensor or film, phosphor plate, whatever that may be. And if you know a little bit about those geometry, you know that one side of the face is going to be closer to the source of radiation, right, the incoming radiation, whereas the other side will be further away from the radiation. So what happens to image that's created by the half of the structure that's closer to the source? Because that structure is now further away from the film, there's going to be more magnification of that structure than the other structure that's closer to the film. I wish I had another image to show you to make my point. So the point is, you're imaging a three-dimensional structure such that one side of the face is going to be always, closer to the film, and then the rest of the anatomic structures will be further away from the film. Meaning, as you get further away from the film and then closer to the source, there's always going to be more magnification. So that's why there's an unequal magnification of right and left side once they get projected. So that's why it's essentially near impossible to have a perfect superimposition of the right and left structure. I shouldn't even say near. It is impossible, theoretically impossible, if you have a perfectly symmetric patient, to have a perfect alignment of the right and left side. So I hope that answers your question, but nevertheless, you want to do your best job of positioning the patient so that there's a minimal discrepancy in the structures. I hope that was helpful and hope that answers some of the questions that you may have had in the past. If you ever wonder why is my radiograph never looked perfect, so there you go. So thank you very much for your attention, and I'll see you next time. Take care.